Hi, I'm Michelle Fuleky. I'm a physical therapist and I'm the director of our student program at Highbar. So the clinical experience at Highbar really starts from the moment you're paired with us, selecting a CI if you have an area of specialty, and our goal is really to help teach you what you want to learn about, from whether it's sports, pelvic health, aquatics. I encourage all of our students to experience all of those while they're with Highbar. When you're looking for your clinical sites, I would really take a look at what does their student program look like. So do they have opportunities to participate in their professional development? How are their CIs trained? What's their volume of students they're taking, from a way to give you an experience that's more than just your typical student experience. So seeing different specialties, pelvic health, pediatrics, aquatics, sports, neuro, do they have those available to you while you're on rotation with them? As a student, as an expectation, clinicals are roughly 30% of your entire curriculum of your Doctor of Physical Therapy program. And when you think about it that way, that's such a huge part of your student experience that I really think when you're looking at clinicals, you should want to experience more than just learning a few manual skills. You learn those when you're in class, but you want to have a clinical instructor that meets you where you are and is able to push you and bring out the best in you and really get you to critically think about patient cases. You want to also have somewhere where you can experience even more than just the day-to-day. What does it look like from an entire clinic perspective? Is the entire clinic stepping up to help you learn? Are there professional development opportunities? What else can you take advantage of? Because you can always learn a few more exercises, you can always learn more manual techniques, but you really want this to be the framework to how you set up the rest of your career. When someone has a great clinical experience, it is setting them up for success from not even just the beginning part of their career, but their entire career. When you look at how they're treated as a student, if they're pushed and their CI is engaged with them, they're taking time to meet with them, they're going over goals, they're really diving into the entire clinical experience, that also will set you up to then be a mentor in your future, to take students in your future, and you can have an even bigger impact throughout your career by knowing that that is what a good clinical experience looks like. I, every once in a while, get asked a question by students when I do their onboarding of what will make them successful in the rotation, and I love that question because that shows me they're already thinking about how they can succeed as students, and really looking at, when you're on your rotation, to be successful, you should be a sponge. You should learn from your CI, but you should learn from the rest of the clinicians at your clinic. And then you should also take advantage by seeing different clinical sites. At Highbar, every clinic has very similar culture. I hear it from all of our students, but everyone has slightly different personalities and there's different experience levels. So taking advantage of that, taking advantage of special interest group, taking advantage of all of our professional development, the dry needling, the Core 4, our new student certification, really diving in and being a part of the team and showing up every day, not just to check boxes, but to really be a part of the entire experience. That's when you'll be the most successful. Yeah, so as a student, you have your DCE that is there to help support you throughout your career as a student and even past. They want to see you succeed as a student in the clinic. Your CIs want to see you succeed. Me as the SCCE wants to see it be a great experience. So we're really a team of how we all work together to help you succeed. So if there are questions, if there are concerns, really connecting everyone together so we can come up with an action plan that best fits you so that you can get the most out of your experience. Whether that's you're struggling with something or you're really crushing it and you're doing well and you really want to push yourself to the next level. As a student, working with your CI to set expectations really starts even before you get there. So communicating with your CI what your goals are for the rotation, and really just it all comes down to communication, right? So telling them what you need, what you want, and keeping that communication going throughout the clinical. Each week setting goals, setting time to meet, and that will really help set you up for success with your CI. I would say at Highbar, we have several students who join our team after their clinical rotation because of their experience at Highbar. They are able to really immerse themselves in our culture and see that our passion for the profession, really we live it day in and day out. We don't just tell people about it, but they're able to really see and experience and take a part of that. So I would say, seeing the students come on as new grads and tell about their student experience and how that student experience then led them to take advantage of the mentorship, and then take that mentorship and then become a peer mentor themselves, and then a year out even taking their own student. I would say that's really the success of the full life cycle of a student at Highbar. If you're the type of person that takes advantage of all that Highbar has to offer, that's the students that really stand out. So the students that are signing up for our drying and needling course, our Core 4 course, taking advantage of the special interest groups, going and seeing other clinics and experiencing aquatics and going through that workout themselves, going to our pediatric gym and spending time with those specialists. Those are really the students that succeed and really sets them up for success in the rest of their career by experience all that we have to offer at Highbar. At Highbar, we are a teaching practice, and that starts from our student program. So taking on students, working with universities on how to help them succeed as a student career, but then also when they come on, we continue to teach. We teach them through mentorship. Then people are able to become teachers. So teaching themselves, being a peer mentor, and then teaching again as a student, going through the residency, then becoming residency faculty, then teaching our courses. As physical therapists, I think we're all teachers in our own way. We teach our patients every day, but a lot of PTs say, I want to teach, I want to be a part of something bigger. And here at Highbar, you're able to really take advantage of that by taking our courses and then teaching our courses. So it gives a direct pathway to that.